We will be starting today with Anthony A.J. Ernst. He will be talking about the Behavioral Health Factors Framework. And without further ado, please welcome Dr. Anthony A.J. Ernst.
Good morning. So a little bit about me. My background is in behavioral health. Started out in Chicago, left home around the age of 15. Eventually found my way into recovery in my late 20s, and then made my way through school, University of Illinois Champaign, and then doctorate program down in Austin, Texas. There's not a lot of difference between the challenges in my day and the challenges today. The drugs have changed, the supports have changed, our evidence-based practices have grown over time, but the fact that so many people do not get well from treatment suggests that things have to change. And realistically, that's what we're talking about today. We're talking about perhaps a new framework for addressing the issue of addiction. Too many people have accepted treatment failure as the norm, and I say that in all seriousness. When an individual with a life-death situation of addiction, and I refer to it as a life-death situation because it is, the fact that somebody may be on a longer continuum with the disease does not negate the seriousness of that disease. And it affects much more than the individual. We don't know the impact that an individual's addiction has. We know the immediate family members, we know friends, but it's much more than that. It's a community. And it goes so far into the depth of how a community defines itself. It goes so far into the depth of the potential that that individual could have provided in terms of economy, in terms of family, in terms of all that that person's contributions could have provided in our lives and in that community. So we really don't know. But the fact that we've not responded to addiction as a life-death illness and a community response has frankly been a failure. So when we look at data and we look at the number of individuals with addiction who have given treatment a chance and walked out failing the first time, we have over time accepted treatment failure as the norm, and we've accepted the gamble that those individuals and family members place on treatment. So how do we know that treatment is effective? Well, you can ask some very simple questions. Before going to a treatment provider, ask them to give you some data. Ask how many of your patients or clients get well after the first treatment episode. How many of them stay well after 3 months, 6 months, 1 year, 2 years? And I suspect you'll be surprised to find that many of them can't answer that. Many of them don't collect that. Many of them don't pay attention to that. And that's the failure of the system. So today it's about thinking things a little bit differently. And we'll be looking at the behavioral health framework for just that. All right, so the framework is about a new approach to thinking about addiction. And the approach is more realistic in terms of the humanity of the framework. So each of us here, I suspect, has a relationship with family, a social system. Each of us, we know, has a relationship with our own selves. So we have a biology about us. We have a genetic disposition about us. We have a link. And even those individuals who are adopted and brought into a family still have a sense of their identity physically. And many of the best practices that we have to address some of the illnesses are linked to medication. That medication is a response to address the biological aspect of a particular disease. So for example, today with the opioid epidemic that many of us are involved with, we have medication-assisted treatment, which provides medication to address the biological aspect of that illness. The other partner for medication-assisted treatment, which defines it as an evidence-based practice, is that therapeutic partnership. So it's the partnership of the physical component, the medication, with the therapeutic alliance through good clinical practice. That's medication-assisted treatment. But those two do not satisfy truly what evidence suggests works for people if the first treatment episode matters. If we take treatment failure as unacceptable and place responsibility for that first treatment episode as a requirement for success. Because frankly, we don't know how many individuals with addiction will come back a second time, or a third time, or a fourth time, or a fifth time. Because every time they come back and it doesn't work, that lessens the chances for them ultimately to give it another try. So let me move on. Sorry about this. I think what you'll find out today is that there's a lot of components to all of this. We're very fortunate to have family members share some of their stories because there are so many components that make this successful that it's oftentimes easier to reflect on our own lives. So we have the biology, we have the clinical aspect in terms of the therapy for medication-assisted treatment. But the other two components are about the world we live in and about the spirituality piece. So when we think about body and the physical aspects, we think about the genetic disposition. And for those in the field, you know that there's a predetermination in terms of your genetic disposition that you need to be aware of. So that if you have addiction, if you have mental illness, if you have co-occurring in your family, that there is some red flags for you to be aware of in terms of your own behavior, things that you need to use caution with. We also know that that many of the physical components can be triggers for us. For example, hunger. All of us can relate to hunger. And we know that if we don't satisfy that hunger, that we'll end up eating things we normally wouldn't eat to satisfy that hunger. It's a drive. Same thing with addiction. So we have a physical component. And in fact, the National Institute of Drug Abuse years ago has identified the physical component of addiction. If you don't satisfy that need, you will resort to things you ordinarily would not. You would resort to choices that are not in your well-being. And that's really the essence of what addiction is, in terms of that physical drive. But there's more to it than that. Second piece of the behavioral health framework, and that's our mind. It's what we know, it's what we don't know. How many times are we guided by misinformation? Some people embrace misinformation, and they never see around it because they surround others with the same misinformation. You know the old saying, birds of a feather flock together. Well, there's a lot of truth to that. And so if we have an individual who surrounds themselves with others who are using, who surround themselves with people in a similar dysfunction, then realistically, how are they to know any difference? It becomes the culture, it becomes the norm. So we have two pieces that stand out to identify human behavior. Physical piece and the mental piece. For medication-assisted treatment, those are the two that we focus on. We provide medication, buprenorphine, methadone, Vivitrol, naltrexone. My doctoral work was funded by DuPont Pharma, the manufacturer of naltrexone. So years ago, when naltrexone was presented in the field of addiction, I was one of the researchers through my doctoral program to do some qualitative analysis on naltrexone and its impact in the field. And we know that naltrexone has been effective, and we know that in many scenarios, especially today with Vivitrol, it's seen as a solution, even currently, to many of the problems that clients face, once a month injections, and we know that it will continue to expand its role, as other medications will. The third area, and out of all of the 4 different quadrants, probably this is the one we pay least attention to in the field. And this is a fault of ours. If somebody were to take away your home, if somebody were to take away your employment opportunities, and for the college students and others here who have some academic ambition, if we were to remove that opportunity from your life, how would that impact your behavior? What impact would that have in terms of your hope and expectations for your future? Addiction does that. Rules many times do that. There is, in the state of Wisconsin, we have a county-driven service, which means that we have 72 counties in Wisconsin. And those counties make determinations as to who to serve, how to serve, based on a contract with the state of Wisconsin. If my residence is in Dane County, and I go to a different county because I'm an addict, and I've left my home, and I surround myself with individuals who are also doing drugs in this other county, and all of a sudden, I finally recognize that my life is in turmoil and I want to do something. I need to save my own life. So I'm going to go to the nearest treatment provider in that county and I'm going to ask for help. That county might tell me no. It's called treatment refusal. No, we're not going to help you because you're not a resident of this county. Now think about that. I am striving to do something about the problem at hand, a problem defined as life-death situation in terms of addiction. I'm giving a treatment provider an opportunity to help me because I'm going to them not knowing really if they can help me, but I don't have any other options available to me. I've most likely burned bridges with my family. I've most likely exhausted all of my healthy relationships. I may have no employment opportunities. I may be living from couch to couch or even homeless. But on this day, I want help. I have a serious addiction. I go to the treatment provider, and the provider says, "What's your address?" I'll give my address. "No, we can't provide service to you. You're outside of our county." Treatment refusal. There's an organization that was developed in November, just started in November of last year, called Wisconsin Family Voices for Recovery. Wisconsin Family Voices of Recovery, made up of family members who have lost sons and daughters, other loved ones, made up of individuals who have challenges regarding addiction, and really challenges with the treatment system as it stands in place in many areas of Wisconsin. They chose something called the No Wrong Door policy to focus on. The No Wrong Door policy is about changing the rules so that the state of Wisconsin could eliminate treatment refusal and through a pool of funds give every one of those 72 counties an opportunity to treat someone. What does that do? If we eliminate treatment refusal, one, it gives that person who says, "I have to do something with my addiction, and I want to do something now," it gives them an opportunity of that warm handshake, of connecting with somebody. And that's really what the world is about. The world is about reaching outside of ourselves. The first 2 quadrants are about reaching within. So who am I physically? What is my genetic disposition? What do I need to do physically to combat addiction? Who can I talk to in terms of a clinical approach that can relate to me? And can that clinician partner with my prescriber so that together as a team I can employ an evidence-based practice, medication-assisted treatment? So I've got that together. And then how can I find a safe place? Where are there sober homes? Where are there opportunities to partner in that relationship with my MAT provider? So with the world, what the framework does is the framework says that as a provider, you need to pay attention to the employment opportunities. You need to pay attention to housing opportunities. And you need to have the employment specialist and housing specialist on the same team as your prescriber, on the same team as your clinician, and they work together as a team to make things appropriate for you. They work together to regain some of the hope that you had lost along the way. And the last quadrant is the spirituality. Now, in the field of addiction, spirituality has had a place for many, many, many decades. It's the higher power. And the higher power can be defined by religion. It can be defined as non-religious. It can be defined by, I'm doing this for my daughter. I'm doing this for something else. But I'm doing it for something that is a power greater than myself. And especially in early addiction, you resort to that higher power. And in the field of addiction, many times the providers are very familiar with the spirituality. They encourage attendance at 12 steps. Or today they encourage attendance at alternatives such as smart recovery or double trouble for co-occurring disorders or other types of self-help. But it's the combination of all four of these areas that define wellness and show evidence for practice, especially in first treatment episodes. So why am I focusing on first treatment episodes? Because most of us are familiar with individuals who are coming to treatment for the first time as failing. That's become the norm. When we have an individual with addiction going to treatment, oftentimes we expect them to relapse. In fact, in treatment, we've gotten so used to it that we say that relapse is the norm. But do we want to embrace that concept? Do we really want to embrace that concept? Or should we raise the bar for treatment providers and say treatment first episode should be at least more than half, more than 50% of your individuals should be in recovery 3, 6, 1 year down the line? So how has the behavioral health framework been applied? This is one example of the application of the framework. This was used here in Wisconsin. In Wisconsin, there were a number of meetings and a number of collaborations that all together brought a comprehensive approach in terms of a solution. Now, the other pieces that are not on here are the employment issues, the housing issues, because at the time, the state of Wisconsin did not bring those into the response. So we have education. We're bringing in a number of responders. We're bringing in a number of stakeholders in terms of educating them on naloxone as a response to somebody who is overdosing. We're educating individuals in terms of the disease concept. We're addressing the issue of stigma. We're bringing in we're increasing the number of prescribers to provide the medication-assisted treatment response. We're expanding our medication disposal. So these are all different components that are bringing in the community, bringing in additional stakeholders to the mix. But the pieces that are not here, the employment, the social aspect, the third component of the framework, that can sabotage all of these best efforts. Because any area that you not address can sabotage everything else. You can have the best medication, the best clinical approaches, evidence-based practices. You can have a commitment to 90 meetings in 90 days. But if you don't have a safe place to live, and if you don't have opportunities for employment, those in itself can sabotage everything else. And lastly, when I was talking with the Dean of Students at the University of Wisconsin-Madison about 2 months ago, we were talking about all of the components within the framework that the university has at hand to address those students. You know, we're unfortunate that we have many, many students that come to college, and they've earned that right through previous courses, through demonstration of academic success, many times through commitment to through a number of extracurricular or other events. They've earned the right to be in college, and yet addiction interferes in that pursuit. And unfortunately, we really don't know what happens to many of them, if not most of them. So what we try to do is we try to, early on, address some of the issues that they're affected by. And note, in this scenario at the university, they have student organizations. They have one student organization called Live Free, made up of students in recovery or seeking recovery who are educating the rest of the student body, 40, 50,000 students, on what addiction is, on how binge drinking should not be the norm, how there needs to be a cultural change in terms of benefits of activities, in terms of sober events, and how sober housing needs to be a place on campus. So in essence, what behavioral health framework is, it's a new approach, but it's not really. It's an approach that all of us use in our lives. We strive to have the best employment opportunities. We strive to be successful in our academic achievements if that's our choice. We strive to surround ourselves with a happy, supportive family and social system. We pay attention to ourselves physically. I look around, I don't see anybody that appears to be in serious need of any hygiene, serious need of anything that visibly we can see. So we take care of ourselves in all of those areas. We need to have the same expectation that when we serve people with addiction, that we give them those opportunities as well. So addressing everything, the biology, the mental health aspect, the social aspect, and the spiritual aspect together as a team has shown to be the most effective approaches for working with people in addiction. Thank you very much.